Question number 12. Which is a paired plexus? Coeliac plexus, aortic plexus, superior hypogastric plexus, inferior hypogastric plexus. Now this question is about the autonomic plexuses below the diaphragm. Just for your revision, remember that these plexuses are located along the abdominal aorta and its branches. From below the diaphragm, you have this medial arcuate ligament and then the lateral arcuate ligament like this. These are the ventral unpaired branches. These are the visceral splanchnopleutic branches. So these three branches, this is the celiac trunk to supply blood to the structures derived from the foregut. This is superior mesenteric artery supplying structures derived from the midgut, and this is inferior mesenteric artery supplying blood to the structures derived from the hindgut. And you also know that there is this sympathetic beaded chain that descends down here from this medial arcuate ligament, which continues down on either side of the spine. This is the right crus of the diaphragm, and here it's the left crus of the diaphragm. So through these crus of the diaphragm, there are greater and lesser splanchnic nerves emerging out. The greatest splanchnic nerves are from T5 to T9, and you have lesser splanchnic nerve from T10 to T11. This is greater splanchnic nerve, and this is lesser splanchnic nerve. And of course, you also have a least splanchnic nerve, that is T12, least or renal splanchnic nerve. So these nerves, when they descend down, and there is the contribution from, there was phrenic nerve descending down. The right phrenic nerve was descending down from this vena cava opening, and the right and left vagi, they descend down through this esophageal opening. So you have right and left vagus, the 10th cranial nerves, as well as the right phrenic nerve. They participate here in an anastomosis, and they form a plexus around here that includes two ganglion here on the sides of celiac trunk. So this plexus formed here, it has contributions from the L1 and L2 segments of this sympathetic chain as well, and that forms this celiac plexus. The celiac plexus diverges out along this different branches, like the plexus around the left gastric artery supplies the stomach. The plexus along the common hepatic artery supplies the liver. It diverges and reaches to the porta hepatis from hepatic plexus, then cystic plexus. Similarly, along the splenic artery, there will be a splenic plexus. So all the way, the different branches, they carry these nerve fibers. Similarly, plexus descends down and surrounds to this superior mesenteric artery. So this plexus, which runs along the superior mesenteric artery, supplies autonomic fibers to the structures derived from the midgut. Now this plexus descends down further like this, and it forms a plexus along to this inferior mesenteric artery as well. And it continues down here further to form a plexus below to this bifurcation of the aorta in its terminal branches. And this plexus also gets a contribution from the lower two, L3 and L4 splanchnic nerves as well. This plexus is called superior hypogastric plexus. This one here is called superior mesenteric plexus. This is inferior mesenteric plexus. And the plexus between anterior to the abdominal aorta, this is called aortic plexus, also called as intermesenteric plexus. Now there's a plexus there in the true pelvis here on the lateral wall of the pelvis, on the two sides of the rectum, on the two sides of the prostate or seminal vesicles, even in case of females, at the level of the cervix on either sides, at the level of the fornixes of the vagina on either sides. So you find is a plexus here, and this plexus receives contributions from S2, S3 and S4 from both the sides, and these are called pelvic splanchnic nerves. And this is actually a parasympathetic contribution to this plexus called inferior hypogastric plexus. While the sympathetic contribution to this plexus is in continuation from this superior hypogastric plexus, and this branch which communicates the superior and inferior hypogastric plexus is called hypogastric nerve. So all the structures within the pelvis, including the parasympathetic innervation of the structures derived from the hindgut, as well as the structures, the viscera within the pelvis, they're all being innervated by the inferior hypogastric plexus. So inferior hypogastric plexus, you have seen here that this is a paired plexus. The rest all the plexuses you have seen in this diagram, they are all unpaired plexus and median plexus. So the question is, which is a paired plexus? So the answer will be inferior hypogastric plexus is a paired plexus.